Warner for public speaking, speech demonstrations, demonstration speech entitled Respiratory Assessment in a Patient. Working as a nurse for the last 12 years, it is on a daily basis I listen to many a pair of lung sounds, none sounding the same as the next. A patient requires a proper lung assessment for many reasons, and it is up to the clinician to hone in on the skill of doing a detailed assessment to aid in the treatment and care you will provide your patient. In today's speech, we will review the following: stethoscope, handling and proper maintenance, placement on a patient, and charting and clinical documentation. This is a stethoscope. There are two types, adult and pediatric. Proper placement on a patient. We will learn how to place the stethoscope on a patient's chest and auscultate the breath sounds. And clinical documentation and charting is required by your healthcare facility. Stethoscope. This is a stethoscope. This is an adult stethoscope. The difference between a pediatric and adult stethoscope is the size of the bell. You never want to use a pediatric stethoscope on an adult patient. Secondly, you will want to make sure you use proper maintenance of your stethoscope and clean it between patients to prevent the spread of infection. This is our test patient. Ms. Barnes, how are you feeling today?
A little congested.
A little congested. Are you having trouble breathing?
No, ma'am.
Okay. We will want to make sure our patient is sitting up in the proper position or laying down. In today's case, the patient is sitting up, and this is the proper placement of this patient. Now we will auscultate Mrs. Barnes' breath sounds to hear what we hear. We will instruct the patient to take a deep breath in through their nose and out through their mouth. Ms. Barnes, in through your nose, out through your mouth. In through your nose, out through your mouth. Lean forward for me. In through your nose, out through your mouth. In through your nose, out through your mouth. Good. One final. Good. Your lungs sound clear today, Ms. Barnes. I think everything is okay.
Thank you.
So after we've listened to Mrs. Barnes' lung sounds, we will then clean the stethoscope before we use it on our next patient. So we've covered proper placement. We've listened to all fields of the patient's lungs, including posterior and anterior. And now we will move on to the clinical documentation piece. Clinical documentation is important for the following reasons. You will want to make sure that the patient's lung sounds have not changed from shift to shift, and the patient's condition may be improving or possibly could be worsening, and you will want to make sure that you relay that to your physician. Conclusion. So, you've just observed the proper technique for doing a proper respiratory assessment. It is critical in the treatment and care of your patient. Lung sounds can indicate so much in a medical picture, and usually a nurse will be the first to indicate a deviance in the normal. You learned today the care of a stethoscope and the importance of sanitation. You became familiar with the proper placement on a patient's chest and the best way to instruct your patient to breathe and position themselves. Finally, you learned the critical link to documentation and follow-up with the physician to aid in the care of your patient. I sincerely hope this short tutorial of lung assessment has aided you in beginning your ability to perform this skill. Thank you.